Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have started discussion on Annavasvatas Vyadhi, and in that regards, we have just completed Trushna as a symptom and Trushna as a disease. In today's episode, we will move towards the one of the commonest symptom which is frequently seen in the practice, and that is aruchi. Throughout in this series, we are discussing every symptom as a symptom itself and as a disease itself. So let us discuss aruchi today. Commonly seen, nothing rocket science for diagnosis. Now you have two patients in front of you. Both are complaining of aruchi. In the investigation or in the examination rather, what we will ask the first question, or we will examine the tongue first. Now one of the patient has a coated tongue and other has a clear tongue, but still he is complaining of the aruchi. For the first person, it's very easy that it is the samata. It may be because of ajirana or agnimandya janit vyadhi, and that's why there is coating on the tongue and samata and samajiva, and in that case of aruchi, you will have to give amapachan chikitsa internally. So a person with the aruchi having samajiva, amapachan is indicated, that may be a agnimandya or ajirana or jwara or whatever the disease is. In second case, the tongue is clear. In the second case, the tongue is clear. Patient says that yes, I can feel the appetite well, but there is no taste on the tongue. Now in this case, you have to think differently. There is no any symptom of agnimandya or samata or ajirana. Patient's agni is good, but he is feeling no taste. In the first case, as I said, there is samata, and in the amavastha, the drug of the ras of choice we have is tikta rasa, because tikta rasa is a shrestha amapachak rasa. So in that case, you will give titrasamaka dravya like sudarshan, etc. Now in second case, there is no samata, agni is well, patient is feeling hungry, but no taste. In that case, you have to think of the local reason. And how we will think in that case, that the taste buds are to be provoked for the tasting function. They are not working well, and hence their stimulation or their function is to be considered, and in this case katuras is most indicated. What is the lakshana of katurasa? We have seen in the past, udvejati jivagram. It makes the stimulus on the tongue, jivagram, and in that case you have to use katurasa for stimulating the function of the taste buds. See, if you use tiktarasa in that case, just because it is useful in aruchi as it is in samata, it will increase the symptom of aruchi because tiktaras itself is aruchikar. So in the second case, to increase the functioning of the taste bud, and you have to have a good stimulus to them, and udvaya jivagram is the reason why katuras is indeed. You can use hinga, you can use any spices, dalchini, etc., and ask them to, again the local action is required, so you can have to ask the patient to chew that material of katurasa in spite taking inside. As katuras is indicated, similarly amla rasa is also indicated because it improves the ruchi in that case. Lavan rasa is also indicated. So even The kalpa like Hingvashtak Churna, Bhaskar Lavan Churna are also useful. Again, ask them to keep in the mouth. Many chewing tablets of which are of pachan in nature are available in market, and you can use that tablets also for the chewing and improving the taste buds functioning. As I said in last episode, if there is a problem in the salivation specifically, and because of dryness of the mouth, there is functioning of tongue is uh, has been influenced, then think of that salivation process in that case. Another factor which is also important and which is many times ignored in the patients, that patient is having hungriness, agni is okay. If you ask the patient to choose something, it also gives you positive answer that yes, I can feel the taste, it is amla, it is katu rasatmak, etc. But still he doesn't find anything tasty. And what will be the reason? In this case, always think of some manasa hetu. In chinta, in the see, it is a rasnendriya, and rasnendriya, indriya comes under pranavayu, man comes under pranavayu, and so when there is shoka, chinta, depression, audasinya, if there is any serious problem in the patient's life, he doesn't feel anything tasty, and even in that case, if you give any rasa, amla, katu, it will not help, or it will help temporarily. Again, patient will say, but okay, even, and how you can ask this or diagnose this? Ask the patient what is the food he likes the most, and that he's liking. If you give the patient that food which he is liking, still he is saying that no, I am not enjoying that food anyway, then always think that there may be a manas hetu, and in that case, first a counseling of the patient you have to do. Secondly, manas chikitsa like nasya, or even in serious cases shirodhara, shiro basti may be indicated. So in the case of aruchi, you will find that in today's practice many a times, other than physical problem, mental problem or manasetu are more seen because of today's stressful lifestyle. It may be anything, social, financial, whatever it is, but in that case you have to go to the root cause of this lakshana of aruchi, and then accordingly give the treatment. Of course, manasa hetu will affect everything, not only aruchi will be there, agnimandya and everything will, it will hamper everything, but you have to keep in mind that this is the hetu which is seen in today's life. We will come with another topic in the next lecture. Thank you very much.